DVB Digital Fast.
Hello and welcome to DVB Newsroom. I'm Nora. Joining me today is Jue Jue Min Thu, a clinical social worker and the founder of Juju Safe Space. Thank you for coming in studio.
Yeah, thank you for having me.
Could you tell us what is Juju Safe Space and when did it start?
Yeah, of course. So Juju Safe Space is a mental health organization. We provide services to Myanmar community in Myanmar, Thailand, and Hawaii. And we founded in 2021, actually 4 years before the coup. So since then, we've been providing services throughout those years. But even before that, I started as a mental health Facebook page to share my mental health journey, and people are starting to ask for mental health support, especially during the pandemic. And once then, I understand the needs for the community, so I registered this organization in Hawaii, and then providing a proper professional mental health services.
Mm-hmm. How do you personally define mental health?
You know, mental health is just like physical health. It's equally important, and especially as a human being, we have emotionals, and especially when we have emotions, this is for the emotional health, as well as, it's connected with your brain health, with your overall well-being, spiritual, psychosocial. So mental health is, related to other aspects of your life.
Mm-hmm. Thanks for explaining. Since the COVID-19 pandemic and 2021 military coup, have people in Myanmar become more open to discussing mental health issues?
People starting to become curious because when everybody's stuck together in the same household or same place, people are starting to experience different behavior challenges. Since then, people are open to reach for help because they're stuck, right? And then, it's become trendy. Mental health, psychological support is become very trendy in Myanmar community, inside Myanmar. And then people are starting to attend training. So for our suicide prevention training during 2001 to 2002, we sometimes have people attending training like 500 people, 200 people. People are starting to feel the needs to get better.
Mm-hmm. Yeah. In a society where talking about mental health is still taboo, how do you destigmatize?
It's a long-term advocacy that we need to commit to continue. So in the Myanmar society, mental health is actually not that we are different from other physical health or spiritual health. We just talk in the different term. So we might be sharing our, like when we're eating tea leaf salad, we might be talking about our financial struggle, our, gambling, like what is a good number to release from these economic stressor, but we're not using in the same term. So therefore, when we are advocating and campaigning to destigmatize, we have to be creative. Mm-hmm. So for example, past 6 months at Juju Safe Space, we launch a public campaign. So every month we have like 14 days of fitness campaign, 14 days of kindness, 14 days of, self-care, this kind of different activities mixed with like physical exercise, spreading kind word in the community, skincare, spiritual care. So we try to mix it up with different level of community engagement and physical, spiritual, mental health. So we have to reach out to the public in a creative way.
Mm-hmm. That sounds practical and kind.
Yeah, of course.
What works best?
What works the best is that we have to talk in a simple language that everybody able to understand. That's why we use mental health instead of psychological, because psychological sounds a bit far for the public and sound technical. So we want to make sure that mental health is also accessible for the public. It's easy to understand. So the language is very important, but also the practices need to be culturally appropriate for our community. We can't just bring the Western intervention and make it work for the Myanmar community because it's different environment, different political atmosphere. So we have to understand these things.
Your work also focuses on the social injustice related trauma. Could you explain what that means?
Yeah, of course. So I grew up in a very politically active community. My dad was a former political prisoner. So I grew up seeing all these injustice in our Myanmar society. So as I am also a social worker, we focus on social justice is the value in treating people with dignity and kindness. So when I try to explain people in Myanmar or mental health in Myanmar, it's not that our people are weak or our people are, suffering with different mental illness and diagnosis. It's basically because we're affected by this unjust society, because we are going through chronic crisis due to the war and conflict. Of course, we're going to experience traumatic experience. So therefore, we need to look at this people suffering from the system approach.
So how do you support someone with this trauma?
Yeah. First thing is to make sure that we're not re-traumatizing them when we talk to them. So therefore, the first thing you can do is to be a safe person. When you are a safe person, you are approachable, you're listening, and you're not judging them. That's the first thing you can do. When somebody feel like they're being listened and their message and their feelings are heard, it's the best thing you can do for the first step. And then, refer them to a qualified professional mental health in the field so that they can get proper treatment.
What advice would you give to people who use alcohol or drugs as coping mechanism for stress?
Yeah, I tend to stay away from giving advice. Instead, my job is to help people understand their choices and behaviors. So when people are using substance to cope, we look at it as from the disease perspective. So what that means is we all are vulnerable to addiction. Some people are addicted to drugs, alcohol. Some of us are addicted to social media, gambling, food, things that to alter our mind. So we don't want to face the problems, right? So instead of avoiding the problem, we need to face it. The way we face it is by doing self-care, intense exercise, and alternative with the healthy habits. So for me, I do yoga religiously every morning to clear my mind. And also when I'm stressed out, I do like breathing exercise to help to cope. And when I'm coping with these things, I also use nature healing. I will go swimming or hiking, just being in the sun, being in the nature that help me calm down as well.
So what is the first step they can try today?
Oh yeah, the first thing you can do is check in with yourself. Ask yourself, how am I feeling? What's my energy level? What is the intention I want to set throughout the day to have a good day, and then living in the moments.
How should a journalist or an average social media be sensitive when discussing mental health online?
Yeah, thank you for asking that. Especially, coming from DVB, we want to raise the awareness. There's the media ethic on the mental health issue too. So for example, we also have suicide cases in the U.S. They are presenting the case as something happened to the person. So we don't say person committed suicide. We say a person killed by suicide, died by suicide, because it's not a crime. So we don't use crime, right? Committed. Also hiding their faces or not explaining, not describing in detail how they die, So yeah, the person dying by suicide, but you don't need to say they hang themselves or they shoot themselves, leaving that detail to protect the dignity of the person.
How can people in rural or conflict-affected areas with limited to no access to internet get mental health support?
So at Juju Safe Space, we just launched our relaxation cards is very hand-on, and you can use these like relaxation cards to cope yourself, and so you don't need any kind of electricity to use these like technique to relax and be mindful. But of course, counseling need to be if they need counseling services, it need to be done by the qualified mental health professionals. So I have clients who reach out to me from Korean state where there's an actual active war. They will come to see me when the Starlink is on. So they might go up to the hill or mountain to talk to me. And then, when there is a will, they will always find a way to make it work. So even there's limited internet, they will find a way to talk to me and connect for their mental health services.
Tell me about your intensive suicide prevention training.
Yeah.
What does it involve, and who is it for?
Yeah, so we're trying to make this as a public information. So it's just like, psychological first aid. In growing up, we have these like, physical first aid trainings, right? So same thing for the when people are facing mental health crisis, when they are distressed, how to help them. At the same time, if people are experiencing suicidal ideation, thoughts and plans, we need to make sure that they have access to our organization and reach out for help. We have trained more than 2,000 people who speak Burmese. Unfortunately, we haven't trained any other languages yet. But hopefully, we're hoping to have access in like Karenni language as well. We're going to Karenni refugee camp to train around 150 people as well. So it's, what that involves is safety planning. When somebody is in crisis, how to make sure we keep them safe. And also we do a follow-up call to make sure they stay alive and they are also following the agreement we have set up together. And then, they can come back more than one time and we are always there for them.
What impact have you seen?
Oh yeah, significant impact. We have saved almost 500 people in 3 years. That's just the hotline alone. So we have peer support specialist hotline for people who don't have suicidal ideation. They just wanted to vent. They wanted to talk their struggle. And then we have the suicide helpline. So together, almost 500 people have reached out to us. That's just for the hotline. But we also provide trainings for humanitarian worker. We have trainings for like trauma-informed approach in healthcare, preventing childhood trauma, preventing secondary trauma for humanitarian workers. So a lot of work are focused around trauma healing work.
Copycat suicides have become a growing concern in Myanmar. So what preventive approach do you recommend?
I think it's a social learning behavior. It's not that we're copying from each other. It's basically that we learn these behavior from movies, the news, how other people are coping. And there's a research showing that when somebody in your family has a suicide history, you're most likely to die by that behavior because of the genetic pre-exposure, because of the learning behavior. So therefore, I didn't know the term copycat, but I know that it's a learning social behavior. So how do we prevent that? It's basically education. Educate. At the same time, we have to advocate for these survivors as well. So in the Myanmar community, I think educating from social, like media, like now, and also we create a lot of videos and contents on our website and Facebook, constant lobbying and advocating to have the policy and programs and funding to support these services as well. So I think we have to do both at the same time, preventing and promoting.
So what should media avoid saying?
I would say that usually in Burmese language, we say it like မိမိကိုယ်ကိုအဆုံးစီရင်ခြင်း instead of committing suicide တတ်သေခြင်းလုပ်ကြံခြင်း because it sounds more like you are doing something bad. So the language we use in the media is a window for the education, you know, because then people understand that suicide is the last symptoms of depression, just like heart attack is the last symptoms of cardiac disease, right? So we need to destigmatize in that kind of language.
So how did you decide to get involved in Myanmar's mental health work, especially during such a difficult time for the country?
Yeah, thank you for asking. So I was born in Myanmar and grew up there until I was 13. And then I moved to Thailand until I was like 13 to 17. And then I went to study abroad. And then I got away. And then I was away from the Myanmar community for a while. But of course, everything I study is to give back to my community. And then when I see the chance that I can actually give back with my chosen profession, and it's a great fit. So, you know, everything I have cultivated to become who I am as a mental health profession, it is what we need for the community as well.
Sure. How do you personally stay grounded and hopeful while helping others who are suffering?
You know what? I use counseling services as well. Because we have to talk about these things. I need to keep myself healthy. So I see my therapist twice a month if I need to, at least once a month to make sure that I am staying healthy. And also I do a lot of workout. You know, I go hiking. I do yoga religiously every morning. I keep myself connected with people who care about me. I feel safe. And especially giving back to the community is how I stay grounded. I see that my people and my communities are suffering. So therefore, I need to stay healthy and also stay connected to be aware of what is going on.
Yeah, thank you for sharing personally.
Yeah, of course.
Looking ahead, what's next for Juju Safe Space and yourself?
What's next is, you know, big things are coming, especially the organization is growing, the needs for the Myanmar community is growing even around the world. You know, I live in Hawaii and we have Myanmar community, small community there, and there are needs there. I mean, yeah, what are you talking about? You live in the US, you know, there are a lot of resources, but Myanmar people prefer Myanmar speaker who can help them in their own language, right? So I have gone to different states, California, Arizona, and also reconnecting with the Myanmar community who can be reaching out for their mental health access as well. So for Juju Safe Space is always going to be there for Myanmar community, probably more engaging and providing more support, and we were trying to elevate our involvement in the community in global level as well.
So you spoke at the TEDx event in Chiang Mai.
Yeah.
How did that feel?
It's been great to be on that stage and sharing my story and my message, and especially our vision is to build the internal peace toward national peace. So, you know, I share my story of my own struggle, but when I build myself stronger and healthier, I can help to rebuild the community, especially, you know, both the communities that I live in, Myanmar community and Hawaii community, have the similar suffering from collective trauma. So having a stage to share my vision with the audience. I mean, Tech Talk has, you know, millions of audience on the stage. We might have a few people, 100 people in the room, but Tech Talk has a large audience online. So hopefully millions of people will see my message and understand Myanmar is suffering as much as Ukraine or Palestine, and we need support. Whether we have support or not, I will and my colleagues will continue to be committed to be there for the community members.
So finally, are there any resources you would like to share with the people in Myanmar?
Yeah, of course. Juju Safe Space is always going to be there for the Myanmar community, and we would like to be the resource and access for mental health care, especially when you are experiencing, distress, mental distress, suicidal ideation, trainings, and any community programs that people would like to collaborate. We're always welcome to everybody. Thank you so much.
Yeah, thank you for being here in the DVB Newsroom, Juju.
Thank you so much for having me.